go? I love that. Anyway. The Committee of Insurance and Financial Services shall come to order. Mr. Clerk, will you please call the roll to establish a quorum?
Representatives Carter,
Present.
McFall,
Here.
Coleman,
Here.
Stone,
Here.
Breen,
Present.
Rogers,
Here.
Scott,
Present.
Young,
Here.
Fitzgerald,
Here.
Grant, Harris,
Here.
Markkinen,
Here.
Zot,
Present.
Aragona,
Here.
Bruck,
Present, finally.
Nyer, Nyer,
Here.
Smith. Madam Chair, you have a quorum.
Thank you. We need a motion to adopt the minutes of May 25th, 2023. Rep. Young has moved to adopt the minutes as printed. Hearing no objections, the minutes are adopted as printed. First on the agenda is testimony on House Bills 4619 through 4623. Representatives Rogers, Edwards, Fitzgerald, Miller, Colazar, and Joseph Sullivan from the Department of Insurance and Financial Services, please come forward for testimony. Representative Rogers, please provide an overview of the package. Rep. Rogers, once you're done explaining the package, please pass testimony on to Representatives Edwards, Fitzgerald, and so on. In the interest of time, please keep your comments to no more than 5 minutes. Representative Rogers, as soon as you're ready, the floor is yours.
Thank you, Madam Chair, for your accommodating this important package and committee members for taking up these important bills. For over a decade, the Federal Affordable Care Act has provided vital consumer protections and access to affordable, high-quality health care for Michiganders. Our residents and healthcare system have come to rely on popular provisions like prohibiting health insurers from denying coverage of individuals with pre-existing conditions, guaranteeing that dependents up to age 26 can remain on health insurance policies, and ensuring coverage for absolutely critical preventative care services. As a practicing physical therapist, I have seen the impacts firsthand when individuals lack access to care. Fully covered preventative services are absolutely vital to ensure that patients do not forego medical treatment until their care is either more expensive or more likely to have a worse health outcome. Unfortunately, recent court cases, including a decision in Braidwood Management versus Becerra, have placed a number of these consumer protections in jeopardy. With my experience as one of the few healthcare providers in the Michigan legislature, I quickly recognized the danger of patients losing access to preventative services. While efforts have been underway for some time to make sure that federal protections for healthcare consumers were codified into Michigan law, these cases and the Braidwood decision in particular have added new urgency to these bills. House Bills 4619 through 4623, as well as our partners over in the Senate, have Senate Bills 356 and 358, take these federal protections and place them in Michigan Insurance Code in order to ensure that Michigan secures these protections for our residents regardless of federal court cases. If these bills are enacted, Michigan would join at least 15 other states that have already placed some or all of these provisions in their own state statutes. I'd like to point out that these bills do not, I repeat, do not go beyond what is already provided under the Federal Affordable Care Act. Conversely, they do not provide weaker protections than federal law either. Since January, the bill sponsors have worked closely with stakeholders across the healthcare system, including Blue Cross Blue Shield, Michigan Association of Health Plans, Michigan Department of Insurance and Financial Services, Protect Our Care, Michigan Leave for Public Policy, Michigan State Medical Society, and so many more. We have heard from providers, patients, health insurance plans, and are continuing to incorporate their suggestions and feedback from stakeholders on all sides. We are working on substitutes that will incorporate a number of these suggestions with the intention to ensure that the bills enshrine the protections of the Affordable Care Act without going beyond those provisions. We should not lose the opportunity to protect Michiganders' access to high quality and affordable health care. While other sponsors speak to their bills, my bill, HB 4619, specifically incorporates the prohibition on discrimination against individuals in healthcare coverage on rates because of their race, color, creed, marital status, sex, national origin, gender, gender identity or expression, sexual orientation, or age. Bigotry, whether it be based on race, sexual orientation, or gender, should never prevent an individual from getting access to health care. We all deserve equal access and equal protection under the law and in the health insurance marketplace. Again, the disastrous Braidwood ruling in Texas creates a precedent-ending access to no-cost preventative services across the country, including here in Michigan. The federal ruling only further increases healthcare disparities in underserved communities across Michigan and around the country. Timing is critical. We need to pass this life-saving legislation soon to continue saving lives with these sound policies. Thank you again, Madam Chair, for your consideration of these bills, and I'm happy to answer any questions either now or after everyone has gone.
Thank you, Representative Rogers. If your other committee members would like to speak at this time.
Thank you, Madam Chair. Thank you, Majority Vice Chair McFall, Minority Vice Chair Harris, and all the members of the committee for being here today to hear testimony on these bills. I wish to thank my fellow colleagues on this package for championing such an important topic to protect the health and safety of millions of Michiganders. As a social worker and community member, I know how necessary this whole package is to preserve access to equitable and affordable health care insurance for Michiganders. My bill will prohibit health insurers in Michigan from either denying or limiting coverage based on pre-existing conditions. That is, a health condition that exists before someone applies or enroll in health coverage. These conditions can include life-threatening illnesses ranging from cancer to chronic conditions like diabetes, asthma, heart disease, or even allergies. Prior to the Affordable Care Act, ACA, insurance companies could deny coverage, change higher premiums, and limit benefits to individuals, including children, based upon their pre-existing conditions. The ACA protects patients from these type of practices, thus limiting the barriers to health care in some cases, may need to save their lives. It is estimated that over 4 million Michiganders with pre-existing conditions benefit from protections provided by ACA. Recent court decisions and ongoing litigation make ACA undeniable vulnerable. Maintaining the authority to protect people with pre-existing conditions, whether or not the ACA is ever invalidated, is important. Let's face it, life happens. An unexpected cancer diagnosis, a child with a chronic health condition, high blood pressure, a life circumstance that require an individual to attain new coverage. Consistent with the protections provided under the ACA, my bill ensures that when life happens, Michiganders will continue to have access to quality and affordable health care when they need it. I am, for one, devastated every time I see someone have to resort to a GoFundMe as a last resort to pay for treatment. I do not want to see an increase in GoFundMes as a result of this legislature's actions or lack, therefore, with this legislation. I wish to thank my colleagues once again for the opportunity to speak, and I would like to now hand it over to Rep. Fitzgerald.
Thank you, Representative. And thank you, Chairwoman Carter, and thank you, esteemed members of the committee, for the opportunity to speak today to my bill, House Bill 4621. I'd just like to briefly speak and share some thoughts on this bill specifically, and with the exceptional background already provided. You know, specifically, when considering where and how you're going to raise your family, health care and health access are without question a paramount consideration. This bill would reaffirm the commitment of Michigan to prioritize the health and well-being of children, young people, and eventually their families, as this bill would specifically cover dependent care and allow for those 26 and younger to be continue to be covered under their parents' health insurance, or their caregivers' health insurance, excuse me. In the end, I do believe that this bill and all the bills in this package will ensure quality health outcomes for some of our most vulnerable, as well as serve as an attraction and retention tool as well for people inside and outside of our state to come join Michigan. With that, I'd like to thank you for your time and pass this over to Representative Miller.
Thank you. Thank you, Madam Chair. I'm here to give my support for this bill package, and I thank State Representative Rogers. Today, I'm here to testify in support of my bill, House Bill 4622, which would prohibit insurance providers from placing a cap on annual and lifetime benefits. By doing so, we could codify this part of the Affordable Care Act into Michigan law. For far too long, our most susceptible populations have been forced to cover expensive medical treatments out of pocket because they've already reached their cap on benefits for either the year or a lifetime. This means that people who are fighting some of the hardest battles of their lives are left to fend for themselves because insurance companies have rules in place that would no longer be allowed to cover these benefits under their plan, and it's too cost worthy for their bottom line. Consider someone who has already reached their annual or lifetime benefit and is now newly diagnosed with cancer. If they had, say, diabetes before and then they're hit with another bomb, this is detrimental. And if the ACA were to fall, insurance providers could deny further coverage to help treat whatever they have been diagnosed with. As we learned just 2 weeks ago, cancer treatments can cost hundreds, thousands of dollars, which could lead to hardships, bankruptcy. And for patients who reach their benefit cap before they are fully recovered, quite simply, this is just unacceptable. The road to recovery can take weeks, months, and even years. I know that firsthand. I've had detrimental illnesses, and it's a battle. And we need to make sure that insurance in Michigan is adequate. And to help, we need to cover these costs. I ask members of this committee to support this bill to ensure that Michigan's insurance system works for everyone and protects those receiving the care. I thank you for listening. Thank you, Chair.
Thank you, Madam Chair, and thank you, committee members, for taking this bill. And also, Representative Brooke, thank you. Welcome back. Thank you for your service. Looking forward to working with you. My bill is one that would require insurers to cover essential benefits. So when I say essential benefits, what I'm talking about are things like ambulatory patient services, emergency services, hospitalization, pregnancy, maternity, newborn care, mental health and substance abuse disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services, laboratory services, immunizations, care for infants, children, and adolescents in terms of preventative care and screenings, all things that affect every single person's life in this room and the entire state of Michigan. Also, by having these essential services covered, it can ensure the prevention of greater health risks down the road, which could lead to even higher costs if those aren't caught early. So this is good preventative stuff that we all use every day, and this bill would just make sure it's enshrined into our state law. Thank you.
Now we will have testimony from the Department of Insurance and Financial Services. Joseph, please.
Thank you, Chair Carter and committee. So, as said, these bills are a bicameral effort to codify federal consumer protections and best practices in state law. And first off, apologies for those in the room that had to hear my Senate comments yesterday. Some of this may be a bit duplicative. DIV supports these bills and is proud to partner with the legislature in this effort. These provisions are popular and they're effective. Since the ACA was enacted, several states have taken steps to codify ACA provisions into state law to various degrees. One reason is that federal action on health insurance reform has been volatile over the past decade. This package presents an opportunity to codify in state law these key consumer protections in federal law to ensure Michigan consumers maintain quality and consistent insurance benefits. Most recently, the decision in the Braidwood ruling, if it stands, would block the enforcement of the zero-cost preventative service provision of the ACA. This decision has been appealed and will be decided in the U.S. Supreme Court. House Bill 4623, as Representative Kolazar said, addresses that in the package. So with that in mind, I was going to provide a short overview of these bills, but I think the sponsors did a really good job of doing that, so I will skip that portion of my testimony. And just say that overall these bills codify federal standards that are already in place that are already helping Michigan residents. These bills provide future protections by ensuring that these stay in place should there be any erosion of these protections at the federal level, either by Congress, the executive, or the courts. As mentioned yesterday in the Senate, DIFS is currently reviewing stakeholder revisions and will provide feedback to stakeholders and our legislative partners as that process unfolds. Part of the reason for that is it's not as simple as us taking the ACA provisions in federal law and copying and pasting those. We have to fit those into our system, into our Michigan Insurance Code. However, I think that the overall intent is clear, and we're happy to continue having those conversations, working with partners as necessary on those specifics. So that's it from me. I am happy to answer any questions members may have.
Thank you, representatives, and thank you, Mr. Sullivan. I'll now open up for questions, and we do have them. Representative McFall.
Thank you, Madam Chair. Rep. Rogers, I just wanted to go back to your testimony regarding how this does not expand what is currently already in place. And also, can you tell us what organizations are in support of this that you worked with?
Sure. So I think probably the chair has a whole list of cards that she'll be reading in, so I'm going to defer to her for that piece. But I will say, as Mr. Sullivan testified, we have been working closely with DIFS, Department of Insurance, and they have been very good partners and very supportive. I don't want to go out there and say full support because it's probably going to ultimately depend on how we do the final versions of the bills. So it's a little bit premature, but all the ones that I listed in concept support the idea of codifying the federal ACA as long as it doesn't go above and beyond. So, Michigan Hospital Association, Blue Cross Blue Shield, Michigan Association of Health Plans, all of the ones that we've mentioned in concept support the idea of codifying as long as we're not going above and beyond federal standards.
Thank you. Rep. Harris.
Thank you, Madam Chair, and thank you all for being here. I do appreciate hearing your input on this. My concern is that the language as currently introduced that we've been able to read, I believe, does go beyond the codification of the ACA. I probably do have a couple of questions, but I'll start with this one. So while enumerated 10 essential health benefits are most consistent with federal law, the delegated language to the DIFS director on preventative care and wellness is very open-ended and concerning. Even the ACA requires proper due diligence and public input before additional preventative care and wellness services can be added as essential health benefits. So in House Bill 4623, would you be open to eliminating the director's discretion, or at the very least requiring the director to follow the same due process and diligence as required of the U.S. Secretary under the ACA?
Thank you for that question, because we had a meeting about this literally yesterday. So the answer to that question is yes, we are open to changes and possibly forming a commission with medical experts, a lot of stakeholders we are all very familiar with that would be able to make those recommendations. So yes, absolutely open to those changes.
Madam Chair, would you mind a quick follow-up? Thank you. So currently, under the ACA, we have the ACA has an advisory committee made up of some of the people that you just mentioned. So if we codify that and we do that here at a state level, what is the cost to the taxpayers to set that up?
To give that exact total view, I'd have to get back to you because I don't have that number in front of me.
Any idea if that involves staff or offices, things like that, that would cost taxpayers money to duplicate that service?
Potentially, but again, I don't have that information for you. But again, when we have it, I'd be happy to get it to you.
Thank you.
Thank you. Representative Smith.
Thank you, Madam Chair, and thank you for all being here and giving your testimony on this. My question is in reference to House Bill 4621, Rep. Fitzgerald, where it amends a section for a disability for age 26 to be included. Currently, I believe Michigan statute already expressly allows a disabled individual to remain dependent on insurance policy. So to me, it just seems like this would be a duplicate, could cause some confusion. I'm just wondering why we would need to have that in there.
Well, with Mr. Sullivan here nodding his head, I might defer to him actually.
Okay.
As
Sure.
this, yeah.
Happy to take that one. Yeah, so that's kind of the question behind all of these, right? So why would we do all of these if these are already in place? I think the uncertainty is the main reason I would point to. As I said, you've already seen a lot of uncertainty at the federal level with the court cases, some potential executive erosion. So at the department, we've heard from consumers. I'm sure the members up here have heard from constituents potentially fearing that some of their coverage is going to be lost, or they might not be able to keep their children on their coverage until age 26. So what we're doing right now is taking a federal standard that's widely accepted, supported by a lot of folks, and just saying, let's go ahead and put this in state law. We believe in this. We're going to support it and have this policy in place permanently in the state of Michigan, whatever the federal government decides to do with this provision. So essentially, that's it.
Okay, thank you.
Representative Breen.
Thank you, Madam Chair, and thank you to the panel for bringing this forward, and Rep. Rogers. We have a lot of good partners in Michigan when it comes to healthcare, a lot of them sitting in this room, and I know that there's been discussions to make sure that we can codify these changes appropriately. What is concerning to me is that I know just a few days ago, the Court of Appeals at the federal level had a hearing regarding striking down some preventative services. Approximately 10 million people could be affected if a particular ruling goes into play. These are things like cancer screenings, preventative services that everybody uses. Again, noting our good partners, especially, Blue Cross, Blue Shield, the health plans, a lot of the insurance companies here. Are you aware of any efforts here in Michigan or in other states where insurance companies are specifically attempting to subvert the intent of the ACA in order to avoid providing these preventative services?
I can lead off with that, and others can chime in. But I do know of 18 other state attorney generals that have this idea in the works to undermine ACA, as well as other legal decisions and courts, as you mentioned. I'm not necessarily aware of things in Michigan, but it depends on who's in charge, right? And for right now, I think have a friendly legislature that is open to these ideas, but I'll defer to Diffs and Mr. Sullivan to see if there's any other Michigan that if he's aware of. But I am aware of other states working towards undermining ACA.
And to go back to my previous point, that's the intent too. So regardless of who tries to undermine this, we're enshrining these protections. And I can say, after the Braidwood ruling was announced, we did have conversations with our health plans and coordinate with them, and they agreed to cover preventative services. And we appreciate that partnership. And these bills are just another effort to codify a lot of these things in place to ensure that these protections remain regardless of what happens in the courts or at the federal level.
Okay, in the interest of time, we have two final questions. Representative Young.
Thank you, Madam Chair, and thank you all for this important legislation. I just had one question around the pre-existing conditions as they relate to dependents who are coming off of their parents' insurance, dependents who have pre-existing conditions like asthma and diabetes. Is there any data that's showing that these dependents, once having to get their own insurance, are finding it difficult because they have been put into the pre-existing conditions where some are not willing to insure them? Anything like that ever come up?
I mean, I can chime in and just say, not right now, but in the past, absolutely. So because of ACA at the federal level, that hasn't been as much of an issue. But prior to ACA being the law of the land, absolutely.
So that's why we need this legislation.
Yes.
Thank you.
Our final question for this panel will come from Representative Nair.
Thank you, Chair. This goes to 4623. Right now, as it's written, it expressly prohibits cost sharing regardless of network classifications. And shouldn't we be adopting the federal language which allows out-of-network cost sharing?
That's another topic that is being discussed right now in terms of substitutes. So once we have that ready, we'll make sure it's to your office because I do understand that concern.
Okay, thank you.
I'd like to thank the panel. Great discussion. Thank you very much, members. We will now read in the cards, and as stated previously, there's quite a few. First card is in support and wishing to speak is Robert Davidson of the Committee to Protect Health Care. Are you here? Yeah. Thank you.
On this right. Can you guys hear me? Good morning. Thank you, Madam Chair, and thank you, members of the committee. And thanks for the opportunity to testify in support of House Bills 4619 through 4623. My name is Dr. Rob Davidson. I'm an emergency physician in West Michigan. I'm also the husband of a family physician in West Michigan. I've been doing this for over 20 years in the state. I'm also here as the executive director of the Committee to Protect Health Care, a mobilization of doctors and medical professionals committed to expanding access to affordable health care. On behalf of myself and the organization, including medical professionals across the state of Michigan, I'd like to share how passing these bills will benefit my patients and the hundreds of thousands of Michigan residents who've come to rely on the protections of the Affordable Care Act, or the ACA. Before the ACA was passed, 1.8 million Michiganders with pre-existing health conditions could have been denied coverage or charged higher rates when attempting to buy health insurance on the individual market. More than 3.5 million Michiganders had lifetime limits on their health insurance benefits. And young Michiganders under 26 trying to complete school or find work were often left without health care coverage. They could be denied coverage just for their gender or sexual orientation. For me, this isn't just about legislation. This is real life. I saw these patients every day in the emergency department. They ended up in the ER because of preventable or treatable conditions that had worsened simply because they couldn't get insurance. Just a couple of examples, and I practiced for as long, sort of half of my career has been without the ACA, about half with. I remember a gentleman coming in 5 days after suffering severe chest pain. Now he couldn't breathe and was in heart failure. If he had come in when he was having chest pain immediately, he could have been rushed to the cath lab, had a balloon in an artery and opened it up and prevented permanent damage. Instead, he ended up with about 20% heart function. And we asked him, well, why didn't you come in sooner? He said, well, I can't afford it. I didn't have insurance, Another guy came in clutching an inhaler that was empty, who had COPD, a truck driver, about 3 in the morning, because I typically work nights. And, he couldn't breathe. And asked him, why didn't you get your inhaler? Well, I don't have a doctor. I couldn't get a refill, and I can't even afford the inhaler if I could. Had to put him on a mask, non-invasive ventilation. Some of us remember from COVID days, BiPAP people would be on. And by about 6 a.m., we said we wanted to actually admit him to the hospital, and he said he couldn't stay in the hospital, and he left against medical advice because he had to go back on the road to make money to pay for that hospital visit. This is a guy without health insurance. And I could just, the countless people with diabetes that were poorly treated and, 20 years later end up having heart attacks and strokes. And so having these protections is so critically important to the question of the cost to the taxpayers of any of these provisions. The costs that are saved to individuals and taxpayers and communities probably can't even be measured. We know as doctors all too well how important it is for them to have access to affordable health care. When they're able to access this, it keeps serious health conditions at bay, and we all do better. Right now, 2.1 million Michiganders are at risk of losing full coverage of preventative services as the Braidwood Management Incorporated versus Becerra case continues through the courts. That's why the Committee to Protect Healthcare is asking Michigan lawmakers like all of you to act. Since the ACA was passed, we've seen countless attacks by members of Congress to try to dismantle it. We've seen the U.S. Supreme Court become ever more hostile towards Americans' health and health care. It's critical to protect Michigan residents from federal threats to their health care. As has been said by other folks, other states are doing this, and we hope Michigan will follow suit to ensure all residents can access the care they need to live and thrive. Thanks.
Thank you for your testimony. And we have 2 testimonies on Zoom. The first one will be Dr. Michael Redinger from the Michigan State Medical Society. There he is.
Thank you.
Thank you.
Good morning, Chair Carter and members of the House Insurance and Financial Services Committee, and thank you for the opportunity to share the perspective of the Michigan State Medical Society and its members regarding our support for House Bills 4619 through 4623. My comments, I think, will be very similar to my colleague who just spoke. My name is Dr. Michael Redinger. I'm a board-certified psychiatrist, member of the Michigan State Medical Society Board of Directors, and chair of the MSMS Committee on State Legislation and Regulations. I also serve as an associate professor at the Western Michigan University Homer Stryker MD School of Medicine, where I'm duly appointed in the Department of Medical Ethics, Humanities, and Law, for which I serve as co-chair, and the Department of Psychiatry. As physicians, we witness firsthand the challenges patients face when insurance coverage falls short. We know that with the recent ruling in the U.S. District Court that struck down a critical provision of the Affordable Care Act that requires most private health plans to cover a range of preventative services without any cost sharing for their enrollees, how problematic this is. Should this ruling hold, millions of individuals could find themselves burdened with increased costs for preventative care, and even worse, some may lose access to essential services altogether. Just 2 weeks ago, I testified before the House Health Policy Committee in support of reforms to the Healthy Michigan Plan, and my message today is the same as it was then. Doctors want to care for patients. We want patients to be able to access care without fear of financial ruin, discrimination, or limitations on coverage. And we know that inadequate insurance coverage is one of the largest barriers to accessing healthcare. Our commitment to delivering the best outcomes for our patients compels us to recognize the consequences of uncertain or lost health coverage. And that's why MSMS stands firmly behind House Bills 4619 through 4623. These bills will protect patients by codifying provisions which currently exist in federal law, by prohibiting insurers from engaging in discriminatory practices, prohibiting insurances from imposing annual or lifetime limits on benefits, prohibiting denial of coverage for pre-existing conditions, requiring coverage of dependents up to the age of 26, and requiring coverage of preventative services. While we await a decision in federal court, your support of this legislation now will help safeguard healthcare coverage for countless individuals and ensure greater access to care and healthier outcomes for Michigan citizens. Additionally, by codifying these protections, my colleagues and I will be equipped to advocate for regular checkups, screenings, and other preventative care measures. It's a well-established fact that these interventions significantly improve overall health and even save lives. So thank you again, Chair Carter and members of the committee, for the opportunity to testify before you today. And I'm happy to answer any questions.
We're going to hold questions, or do we want to do them now? We're going to hold them till our final Zoom presentation. Can you stay on? Okay, thank you. And our final Zoom presentation is Liz Hagan of Us for Care. Is she there? There she is. Liz?
Thank you, Madam Chair and members of the committee. I'm Liz Hagan, Director of Policy Solutions with United States of Care, and I'm here to offer our support of House Bill 4623. United States of Care is a multi-state nonprofit organization working to ensure everyone has access to quality, affordable health care, regardless of health status, social need, or income. We appreciate the committee prioritizing access to care by hearing this and other ACA codification bills, and are particularly sharing our support for House Bill 4623 because it allows for continued access to free preventive services, which we see as important for access to high-value care while also lowering costs. This bill will require plans to provide coverage that meet certain standards and cover certain services within 10 categories of services, known as the 10 Essential Health Benefits, or EHB. As part of EHB requirements, plans have to cover things like preventive care, maternity care, and mental health and substance use disorder services. These protections are critical. For example, before the ACA, 62% of people enrolled in the individual market had no coverage for maternal care, and 34% of people in the individual market had no substance use disorder coverage. This bill also importantly includes protections for no-cost preventive services recommended by medical experts, which was one of the core pillars of the ACA. As mentioned, these services are an important tool for detecting illness early, improving health outcomes, and keeping healthcare costs low. And nearly 4.7 million people in Michigan overall, including 1.2 million people, received free cost preventive services in 2020 alone. As Representative Rogers and others have shared, there's urgency with this bill due to the court case occurring now that is likely to make its way to the Supreme Court. With a hearing just this week about whether these services should be required to be offered as the case moves through the appeals process, it's commendable that Michigan lawmakers are taking such swift and bold action to continue existing requirements at the state level. We know that people's concerns about costs keep them from getting preventive services. We also know that nearly half of people report not being willing to pay for some of those common preventive services, such as HIV screenings or tobacco cessation, if there were a cost. Eliminating access to these services would likely have a disproportionate impact on communities of color, low-income people, and the LGBTQ community, which would reverse the progress made towards reducing healthcare disparities. Federal law includes protections for all no-cost preventive services, and we recommend this clarification be made in HB 4623. This clarification would protect services specific to women, infants, and children, as well as vaccinations recommended by the CDC, in addition to the recommendations for adults made by the United States Preventive Services Task Force. Michigan has an opportunity to join the other 15 states that have protected people's access to free preventive services, so families stay healthy without worrying about cost. And we urge the committee to vote in favor of advancing this bill. I would be happy to answer any questions at the end of this section, and we hope that you consider the experts at USF Care as a resource as you work to advance this and other ACA codification bills. Thank you.
Thank you for your testimony. And now if any members, do you have questions? Well, hearing no, I have a lot of cards to read in. First of all, not wishing to speak and supporting the bill, Kevin McKinney of Michigan Osteopathic Association. Not wishing to speak and supporting the bill, Aaron Knorr of Equality Michigan. Not wishing to speak but supporting the bill, Don Kettinger, Michigan Nurses Association. Not wishing to speak but supporting the bill, Sean Sorensen Abbott, Michigan Health and Hospital Association. Not wishing to speak and supporting the bill, Frank Waters, Michigan Primary Care Association. Not wishing to speak and supporting the bill, Michelle Roberts, Disability Michigan, Disability Rights Michigan. Not wishing to speak and supporting the bill, Matt Black, Michigan Academy of Family Physicians. Not wishing to speak and supporting the bill, Sherry Board, the ARC Michigan. Not wishing to speak and supporting the bill, Kelly Doyle, the HIV/AIDS Alliance of Michigan. Not wishing to speak and supporting the bill, Patricia Barton, American Association for Marriage to Family Therapy, Marriage and Family Therapy. Not wishing to speak and supporting the bill, Melina Brand, National Association of Social Workers. And not wishing to speak but opposing the bill is Amanda Fisher of the National Federation of Independent Businesses. Okay, quite a list. Thank you, everyone. And now we have next on our agenda is testimony only on Senate Bill 326. Here to explain the bill is the bill sponsor, Senator Singh and Kurt Berryman, Legislative Director of the Auto Dealers of Michigan. Thank you both for coming. Please come forward. The floor is yours.
Thank you very much, Madam Chair and members of the committee for taking up this bill for testimony today. Senate Bill 326 is a very simple bill. As you know, the Use Tax Act exempts automobiles for resale from the tax. Currently, right now, we are going through a process that you're probably aware of with the Secretary of State's office by creating a electronic lien process. And as we go through that process, there is a technical piece that triggers potential tax implication. And that is using the definition of convert that's currently in the Act itself. So we've been working with our friends at Treasury, the Department of State, and obviously with the Auto Dealers of Michigan to try to deal with this situation. And so what this bill does is it acknowledges the changes that are going to be happening with the new Secretary of State system, but it continues to exempt automobiles that are here for resale by our auto dealers across the state. I think you've seen from the House fiscal analysis as well as from Treasury, there should be no revenue implications whatsoever, since they weren't already taxed previously. And so we just wanted to make sure that this was done before the new system takes place in October. And so we appreciate your sense of urgency, Madam Chair, for taking this up. And we hope that once we answer all questions as this goes through the process, that we will have the support of members of the committee. So let me turn it over to Kurt, and he'll give you their side of the story.
Thank you, Senator Singh. Madam Chair, thank you for taking the bill up today. I'm Kurt Berryman with the Auto Dealers of Michigan, and I'd be remiss if I didn't give you my little PR pitch. I represent about 600 dealers across the state of Michigan, both the Michigan auto dealers who are up north and the Detroit auto dealers, about 200 dealers in the southeast Michigan, put on the auto show every year. Hope you will join us at the auto show this year. Yesterday was the announcement of the September show. Going to be a lot of excitement, a lot of electric, a lot of driving, hands-on stuff. Senator Singh did a great job explaining the bill. The House fiscal analysis is a piece of literary magic. I mean, you just really couldn't cut to the bone quicker than this. As Senator Singh said, all retailers get an exemption for inventory that they purchase for resale. It's in the Sales, it's in the Use Tax Act. We as auto dealers also get a use tax and sales tax exemption for inventory that we purchase for resale to the customer. As Senator Singh mentioned, there's a little conversion provision in the Use Tax Act that where you can take an exempt use tax item, and by converting it, by using it for a non-exempt purpose, then it's subject to tax. And with autos, kind of always the trigger or red flag, I hate to use red flag, but the trigger is if the dealer actually titled the vehicle in the name of the dealer, that's like, well, maybe they're using the vehicle for a non-exempt purpose. As Senator Singh said, probably about 6 years ago, this legislature, in their wisdom, started the process of converting the state to an e-title system where you're going to be able to get your title electronically and clear your lien. And when that happens, almost every vehicle that we as dealers now purchase for resale, whether it's at auction, whether you bring in a trade-in, whether we buy something from out of state online, we're going to have to get one of these e-titles. So under current law, that would trigger. That would pop that trigger because we're titling the vehicle for Treasury to come and take a look. Now, we worked it out with Treasury, as Senator Singh said, a better measure, a better, red flag for Treasury will be if the dealer actually registers the vehicle, puts it in his name or her name under the dealership. Then you know they're going to be using it, whether for a courtesy vehicle or a parts vehicle or what it may be. So it is a very simple change, no revenue impact, and be happy to answer any questions.
Thank you, Senator Singh and Mr. Berryman, for your testimony. And we have questions, starting off with Minority Vice Chair Harris.
Any questions except from Representative?
Thank you, Madam Chair. Mr. Berryman already knew I was going to set him up. Thank you, Senator, for doing this and being here. And Mr. Berryman, I'm always looking for a tax cut, but I suppose I can probably get behind this. It's more of a statement than a question. So thank you for being here, both of you.
Are there any other questions? Oh, Representative Rogers.
Thank you. Sometimes these things are a little bit technical. Do you have any real-world examples of this happening, or do you have any constituents that have brought this to you, Senator?
No, because obviously the electronic system doesn't go into effect till October. This would then have the implication there. That's where we would have heard from the dealers and so forth. And so I've not had anything specific at this point in time, but perhaps Kurt does.
Really a great question, because as I explained, right now titling is the trigger. And as the industry changed, particularly during the pandemic, we're probably titling, because we have to, more vehicles that we're purchasing for resale than ever, whether it's through auction. There's states, anybody ever trade in or sell a vehicle? In Michigan, you flip it over and you can assign that thing about 5 times without ever transferring title. In Ohio, that's not the case. We bring in a car from Ohio, we actually have to transfer the title and take that title. So as we've purchased more vehicles from out of state, it's happened.
Thank you.
And we do have examples.
Are there any other questions, members? We're hearing none. Thank you Will, for your testimony.
Thank you, Madam Chair. Thank you very
You're
much.
so welcome. The last item on our agenda is a vote for House Bill 4331. We need a motion to report House Bill 4331 with recommendations. Representative Breen moves to report. Mr. Clerk, will you please call the roll?
Representative Carter,
Yes.
McFall,
Yes.
Coleman,
Yes.
Stone,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Harris,
Pass.
Markkinen,
Pass.
Bazat,
Pass.
Aragona,
Yes.
Brook,
Yes.
Nyer,
Pass.
Smith. Madam Chair, you have 12 yeas, 5 passes, 0 nays. It prevails.
Thank you. House Bill 4331 is reported with recommendation. That's for you, Jonathan. Okay. Seeing that we have the entire committee here today, once again, welcome Representative Bruck. So good to see you. We need to have a motion to adjourn, and I think Representative Brooks is going to adjourn the meeting. Hearing no objections, this meeting is adjourned.